بسم الله الرحمن الرحيم. أبنائي طلاب جامعة بحري عليكم، علكم طيبين وصحة. رمضان كريم وتصوموا وتفطروا على خير وربنا يتقبل منكم الطاعات إن شاء الله. Today we are going to discuss a very common problem, which is schistosomiasis, schistosoma, and this is a very common disease in Sudan, and it's the most major cause of morbidity in tropics, especially in Sudan and Egypt. Schistosoma species are Schistosoma hematobium, Schistosoma mansoni, Schistosoma japonicum, Schistosoma mckinnogi, and Schistosoma intercapsulatum. And Schistosoma mansoni hematobium is also called bilharzia or bilharziasis. The life cycle: the ova is passed in the urine or feces of infected individual to the fresh water, and it enters the intermediate host, which is the snail, and multiply on it. Cercaria are then liberated into the water, and they can survive for 2 to 3 days. Cercaria can penetrate the skin of a human being or the mucous membrane. Then it transforms to schistosoma and pass by the blood stream to the liver and the portal vein where they mature. Male worm up to 20 millimeter in length, and 4 to 6 weeks of infection, they migrate to the venules draining the pelvic viscera, where the female deposits the ova. The disease is usually due to granuloma reaction of the egg deposition in the tissue, especially in the liver. The egg of Schistosoma hematobium pass mainly through the bladder and may involve the rectum, seminal vesicles, vagina, cervix, and uterine tubules. Schistosoma mansoni and japonicum egg pass mainly through the wall of the lower bowel and where it was carried to the liver. Pathology: the most serious rare site of ectopic egg deposition is in the central nervous system. Granuloma is composed of macrophage, eosinophils, epithelial cells, giant cells around the ova. Later, fibrosis and calcification may occur, where often visible radiologically. Schistosoma mansoni egg may leave the vesicles, the seminal vesicle plexus, to the lung, and Schistosoma mansoni and japonicum egg may also reach the lung after development of portal hypertension and portosystemic collateral circulation occur. So the egg deposition in the pulmonary vasculature lead to pulmonary hypertension. So it may lead to portal hypertension and pulmonary hypertension. The clinical picture: usually swimming itch. The patient will develop itching 1 to 2 days at the site of cercaria penetration, and also may develop Katayama syndrome, which is allergic reaction like urticaria, where the patient develops fever muscle ache, abdominal pain, headache, cough and sweating, and hepatomegaly, splenomegaly, lymphadenopathy, and pneumonia. So the patient initially might develop articular rash, but later on the patient might develop hepatomegaly, splenomegaly, lymphadenopathy, and pneumonia. Some Mansoni common symptoms include paleness, terminal hematuria, frequency of micturition, frequent urinary tract, bladder and ureteric stone. So stones may develop in the bladder and the ureter, and with hydronephrosis and renal failure later on. Squamous cell carcinoma of the bladder also is common. The clinical feature also in Schistosoma mansoni, the common symptoms include malaise, abdominal pain, frequent stool which contain mucus and blood, hepatomegaly, portal hypertension, massive hematemesis, liver fibrosis, and cirrhosis. Schistosoma japonicum and Schistosoma myclonoi and Schistosoma intercapsulatum clinical feature resemble those of severe infection, Schistosoma mansoni, with added neurological feature. Large bowel may be affected, hepatic fibrosis and with splenic enlargement is usual, and the spleen is usually huge in size. Egg deposition in the central nervous system may cause epilepsy, hemiplegia or paraplegia, and sometimes may cause even blindness. Investigation, of course you can do ELISA, and this is very expensive, but the most simple one, we do CBC, where you will find eosinophilia and microscopy of centrifuge deposit of the terminal unit. You will find the egg of bilharzia with of the Schistosoma hematobium. Also, you may do ultrasound where you may find thickening of the bladder, urinary bladder wall, and also you may find hydroureter and hydronephrosis, and in Schistosoma mansoni you may find periportal fibrosis and alignment of the portal vein caliber. Also, you may do cytology. Also, you may do stool general with characteristic egg with lateral spine can usually be found. Renal biopsy, in case of renal involvement, sigmoidoscopy and cytology. Management, of course, you know that the treatment is pretiquintel. The dose of 60 milligram per kilogram body weight. Okay, thank you. Any questions?